just to introduce myself first, my name's Sally Clee, and I'm the Education Training Manager here at the school. And I'm going to obviously be going through reflecting for the observational training activities. So basically, the training activities you do in phase one of your training, which is the rotation modules. Now, you probably noticed, if you're eagle-eyed, that I've changed the title of the session slightly. So originally it was an introduction to reflective writing, and actually I reflected on it, and I sort of thought, well, actually it's not about reflective writing, it's about thinking reflectively, because the format of how you do that is, can be written, but it doesn't have to be, and I'll come to that a little bit later. Just to say, I did do one of these sessions on Tuesday aimed at training officers, so about their role in supporting and assessing you to think reflectively for these OTAs. And the recording of that will also be made available on our website. So you can have a look at that one too, so that you can see it from the perspective of what we're suggesting that trainers do in terms of supporting you with thinking reflectively. So really clear what we're going to do. We're just going to look at, how you can go about basically doing your reflections for the observational training activities. As a starting point, some of you might have already accessed these, but if you're new to reflection and reflective practice, then we do have these quite general modules. So it's just 2 modules on reflective practice on the Learning Hub. So we strongly recommend that you look at those, because it gives you a good starting point with reflection, especially if you haven't had any experience of it before. And for our for the whole session for Q&A, we're going to be using Slido. So hopefully we'll get plenty of time at the end. We've got quite a lot to pack in today, but we'll get some time at the end for you to ask your questions, and I will try and answer them as best I can. But we're also going to use it as a tool for you to look at some polls, to answer some polls rather, but also have a look at a couple of sort of generic examples of reflection a bit later, for you to have a look at it in practice as well. So we're going to kick off with 3 polls, just to gauge where you're at already with your experience and understanding. So I'll open the first one up. And if I bring this up on screen, you can still see the details of how to join there and the QR code there. So our first question is, what is your experience of reflective practice prior to the STP? So someone's kicked us off with none, very limited, okay? Okay. Yeah, not much. And nothing, okay. Okay. Okay, Brill. So we've got a bit of a mix here, which is really interesting. Yeah, personal reflection, day-to-day life. Yeah, we do it without realizing we're doing it in a lot of ways. But when you're doing it in a professional context, it can be quite a skill. Oh, fab. So we've got a mixed bag here. So we've got some with quite a bit of experience because they did it previously in a clinical undergraduate program. Yeah, some very personal reflections in relation to mental health or just day-to-day life. Yeah, therapy, I saw one. Yeah, so reflection can be used for all sorts of things. And if you think about it, sometimes people see it as something a little bit alien. and think this doesn't sit right with me. And sometimes we get that from scientists as well, because they deal with, you know, facts and definites. But actually, if you think of the world of science, that if people hadn't reflected, then things wouldn't have progressed. So it's not about just looking at your feelings. It's actually about looking at an extension of that and what we can take from it and then learning from it. So which we'll go into a bit further. And yeah, actually, that's a really good point. That, you know, we do reflection a lot as human beings on a day-to-day basis, but we don't sit there and say, right, we're going to sit and write this down. We use our experience on a day-to-day basis to reflect in many different ways as well. And so some of you did it as part of the PTP, so that's fantastic. So I've got a bit of a range there. So I'm going to open up the next poll, is sort of an extension of that. So some of you, it will be rarely, some of you daily, and that could not just be professional reflections. That can be on a day-to-day basis, you know, your personal, professional, personal development, etc. Okay. Again, we've got a bit of a mix there, which is really good. That could be really positive, because those that feel that, you know, that they've got a lot more experience of doing it than others can actually support those with less experience when we come to do some of the discussions. Okay. And then our final initial poll is going to be, what do you see as your biggest challenge with reflective practice or reflection? And that's a big question, I do recognise that. But particularly with your OTAs. Okay, structure, so that's a good start. Okay. Talking in first person, yeah. We get that from those that from similar backgrounds to yourselves in terms of academic backgrounds, where find it difficult sort of feeling fake sometimes. Yeah, okay, I can actually know what you mean by that. Yeah, feels like a chore, too structured, knowing what to say, doesn't come naturally to me, showing what you've learned. Yeah, okay. Hopefully I can help with some of this today. That's my aim. The ones that you'll do for the uni will be different to the ones that you do in your work-based practice. Obviously, they'll have their guidelines for that, but you can take what we're talking about today definitely to support you with those. Yeah, okay. Feels like a tick box exercise sometimes. Okay. Yeah, okay. I like that one at the top. When I'm just shadowing someone, it's difficult to talk about your action plan. Yeah, and it can be a challenge. Starts feeling repetitive. Okay. Okay, so we've got some good ones there. So this is actually makes me quite happy, because I'm hoping I can alleviate some of these challenges today. Describing feelings, writing it down. And again, we'll come to that. Okay. They're really useful for me, because not only today with what we're doing, I'm hoping that I can answer a lot of those, but also after today, I'm going to put together a little resource in the Learning Hub around a complementary resource, if you like, linked to what we do today, because I'm going to go through quite a lot today. And although you can watch the recording afterwards when it's uploaded to our website, I want to put some things alongside that to support you as well, because someone just talking about it can be quite overwhelming. So if we have something that you can reflect on and ponder beyond that, that hopefully that will help too, and I can incorporate some of these if need be. So to set the scene, and some of you might be all at different stages at the moment. I thought it'd be important for us to just look at what we mean by the observational training activities. And this is just simply taken from our work-based assessment standards. So if you haven't looked at these, then we strongly recommend you do, because this helps guide you in terms of what's expected for the different training activities, and in this case, the observational ones. It's on our website. You can easily find the work-based assessment standards. But the reason why I'm bringing these up is to set the context, really. So basically, with these OTAs, the purpose is for you to be introduced to that developing an understanding of practice in the department that you're that you're positioned in. And also the activities themselves are aimed to provide you with that awareness of the wider context in which you're going to work, and how that wider context will impact on your own practice. And so the evidence that you produced needs to do these things. It needs to be able to contribute to your wider understanding of practice. And it might be that it expands already existing knowledge. So if you've had the background already, like some of you have mentioned the PTP in that first poll, then it might expand your understanding of that role, or that experience, or working in that context. It might challenge it. So it might actually challenge some preconceived ideas you had about it, or it might, you might have some light bulb moments, if you like, of, oh, right, I didn't realize that was why we did that, or that's why that is set up in the way it is, whatever it might be. Or it might reaffirm what you already knew. So if you've got some experience already, whether that's personal experience, of being a patient on the side of receiving care, or if you've already undertaken a professional qualification that is related to the STP, then it might reaffirm what you already knew, and that's great. That's not an issue at all. But it sort of provides you with expanding that perspective of practice. So in the curriculum, it's really important that you look, when you're looking at your training activities, you look at the curriculum, and that training, you click on that training activity and look at it carefully. So, discussing it with your training officer is really important. The learning outcomes themselves related to that training activity, because you'll see that in the curriculum, each training activity is mapped against a number of learning outcomes, and looking at that can help you contextualize that training activity a little bit more, and use the considerations to help guide you. Now, just to mention, and I've put it under there as well, they are generic, those considerations, but it can help you when trying to look at a specific training activity and get your head around it. They're not a checklist, those considerations, so it's not an exhaustive list. So there might be things that aren't listed there that you observe or you want to focus on, and that is fine, as long as you can satisfy the training activity and the expectations of your training officer in relation to that training activity. It doesn't matter in that sense. There's a couple of definitions there. I'm not going to read them out. You can see them for yourselves there. But the key emphasis, rather, with reflection is that learning from an experience. So we don't just automatically have an experience and we learn from it. We have to reflect on it. We have to take that step back in order to elicit the learning from it. And you can see in real world, where reflection doesn't happen enough. If you think of some of the high profile cases, so for example, I live in Shrewsbury, and there was a big scandal, if you like, in the local hospital around baby deaths. And you might have seen on the news, and now we've got ones coming up in other areas of the country as well, where there's being big investigations and exploring why those were. And a big part of that is about people not reflecting and looking at and learning from mistakes that have happened. And that's what it can be around as well, in terms of in the professional context, people learning, as not just individuals, but as a team or as a department, not learning from mistakes that have happened. And so they might have had these experiences, but not actually investigated why something has gone wrong. And that's what reflection is about. Is ultimately about learning from doing, but actually taking that step back to actually inform practice. So on a large scale, you can have it in a departmental way, but if you've got more and more people being reflective and demonstrating those reflective skills, and taking action following those reflections, then you can, it's about minimizing risk as well in terms of behaviors. So why reflect? In simple terms, since 2022 and the new curriculum was introduced, it was embedded into that curriculum much more, but it's always been commonplace in the clinical arena. So doctors, nurses, allied health professionals, they've all been expected to engage in reflective practice, and not just as part of their training, but beyond that as well. So it's become commonplace. If you think, it's about evidence-based practice, so it's not just about how you felt about a situation, even when it comes to your assessment, it's about what you observed and what you're going to take away from it, if we think of it in that sense. Some of you have already come up with this, but about it leads to improved practice, and it's an essential component of lifelong learning as well. So to be that lifelong, recognised as a practitioner, you want to engage in lifelong learning, then it's an essential component of that to be able to revisit and reevaluate experiences that you've had in order to enhance your practice. So, as we've said, it's strongly that the main reason for reflective practice and reflecting on practice is to develop learning from those experiences. And Jenny Moon, she has written a lot about reflective practice in a very practical ways, and identified how there's these 5 stages of learning that we go through whenever we are having new experiences. So stage 1 is we notice what's happening, what's going on around us. So you register an experience or event as being interesting in some way or important to you. Then you make sense of it. So that's where you think more about what you've noticed and try to understand it better. So that involves you starting to take a step back and having a think about it. And then we've got stage 3, which is making meaning. So that's where you start to ask questions and to connect ideas together. And you start to make those connections with what you've previously potentially experienced as well. And this is the sort of crossroads point to where you start to get to deeper learning. So those first 2.5 stages, if you like, are more surface learning. So it's quite superficial. But once we start to get to stage 3 and beyond, we're starting to get into that deeper learning, which some of you mentioned when you were asked what the purpose of reflection was. So you go from making meaning to starting to work with that meaning. So you start making links with other ideas and events. If you were doing academic reflections for your university program, which some of you mentioned, you probably start to refer to literature and other research there. But in terms of your OTAs, say that you start to draw on, sort of previous knowledge there. And this is where reflection is starting to take place. And this is where your learning is starting to get deeper. And then we've got the transformative learning at the end. And that's where you've reached the point where you can apply that learning. And they know, someone would know what to do if a similar situation arose in the future, because they can draw on the learning that they've gained from previous experiences. And as we said, reflection is very much a skill. So your early reflections might be very much in these early stages, and that's not a bad thing, because it's about developing the skill. And the more you engage with reflection, the more you'll start to gain this deeper learning. Oh, gone backwards there. So reflections for your OTAs then. So these observational training activities. Now it does say in your in the curriculum and in the assessment in the assessment standards, it does tell you that you've got to reflect at 2 different time points. And so you could look at it as a 4-dimensional approach to reflection, and there's 4 time points that you could actually choose from if you wanted to. So you could do all 4 if you were really keen to, or if it was a situation that you felt actually warranted it. So there's the reflect before action. So that links very strongly with Moon's noticing. So you start to notice that the situation is important in some way, and it might be important because you have to do it for your program. But it's about you thinking about how you're going to approach the situation before you enter it. So, and that could be drawing upon previous experiences, but with the OTAs, you might not have any previous experience of it. And I'll come to how you can plan for that shortly. And it's sometimes described as preflection, because you're not reflecting, you're not looking back, you're actually preparing for it. Then we've got the reflect in action, and that one occurs during the event. So that could link to the making sense element of Moon's learning, because you're trying to make sense of the situation as it unfolds in front of you in real time. And it's the moment-to-moment decision making that you engage with during that event or experience. So if it was something where, it was a professional who's qualified and they've had lots of experience, and they go into a clinical situation that they've done many a time before, but they are presented with a patient that is out of the norm in terms of what they're seeing in terms of their results or whatever it might be, or they're upset or they seem really distressed, then that professional would draw on previous experience to actually change the way that they're doing or approaching that patient in that moment to moment. They haven't got time to go and take a step back and go in the other room and sit for half an hour to think about it. They've got to be responsive, and it's very dynamic. So it's about how someone might adjust what they're doing to best handle that situation in front of them. Reflect on action is what we think of as reflecting after the event, basically. It's when you take a step back after the event and consider what happened and what you can learn from the experience. And then importantly, how it's going to influence your future practice. So what are you going to do to implement those new ideas or experimenting with that new learning? Sorry, I just heard that go off. Let me just let that person in. So, let me move that over. Annoying when it does that. I apologise. So, yeah, so that reflect on action is after the event. It's very much linked to that making meaning and working with meaning from Moon. You will recognise there's lots of models of reflection to support you to do reflect on action. So someone mentioned in our work like Gibbs, that is one which I've always personally struggled with Gibbs as a model. I prefer Kolb, but that's down to personal preference. But actually for the OTAs, I would say that you might choose a different model, which I'll come to after, but there's no prescription. So nobody's going to say to you, you must use this model for the OTAs. It's down to personal preference. You might not choose a specific model, but just go through a specific, ask yourself some key specific questions to make sure you are reflecting. And I'll come to that after as well. Reflect on action can be when things go wrong. And that's what people think, that reflection is always about reflecting on when things don't quite go to plan and identify why that might be. And that is important. And that can be really important for you personally as well, because sometimes we can walk away from a situation when it hasn't gone how we planned, and we can put a lot of blame on ourselves and think it's something that we've done wrong, when actually it could be that there's no blame to be had. It's just that there's some learning points from it. And that's what reflection is about. So about beating yourself up and thinking, you know, I did this bad, did that bad, and didn't do this well at all. It's about actually saying, right, that didn't quite go how I expected it to when I first approached it. What can I get from that in order to prevent that from happening again, or manage a situation like that better in the future? And that's what it's about. But it can also be doing, you know, reflecting on action when it's gone really well, because it's important for us to understand why things go well in order to help us in the future when faced with something challenging, and we can adopt some different strategies to actually handle that. Excuse me. You can also use reflect on action to actually reflect back. If you engaged in reflect in action and before action, you can actually draw on that and say, well, actually, I think I reflected in action really well in order to respond to the situation that I was in. Or you can also say, right, if you think of your OTAs, you can reflect on action, but also if you reflected before the event, you can, as part of your reflect on action, say, I had my expectations really challenged when I engaged with this activity or experience. It wasn't quite what I expected, and I admit that. And I think that maybe going forward, I would, you know, explore that aspect of that role further, because I thought it was really fascinating, or I appreciated the way that they communicated with that patient, and maybe I need some more need to practice my communication skills moving forward as well. So, you know, you can, it's cyclical. You can, if we're going to do all four, they would feed into each other, which leads me to reflect beyond action. And this is very much linked to that transformative learning that Moon mentions. And in other words, we describe this as looking at it in a lifelong perspective. So it's not about treating incidences as isolated, or treating experiences as isolated incidences. So it might be that, you know, the way we learn, we don't just learn from one experience. We're made up of multiple experiences as a human being, and how we practice and what we do. So revisiting and rethinking about an event later, following lots of other experiences, can actually enhance your learning from that situation. So one example of how professionals do that across different disciplines actually, but in health and medicine, is using what they call professional storytelling to enhance that learning. So sharing experiences, so professionals sharing their individual practices and experiences with each other, means that they can glean new learning from it. So they get feedback about, you know, so, or challenged about how they went about something, or they're honest about, you know, I don't think I've dealt with this very well, how would you have done it? That can actually enhance learning for everybody who's involved in that. because it enables others to revisit their own in light of that conversation as well. And again, that can then inform that reflect before action and that reflect in action as well. So as I said, it's cyclical. When you look at those 4 different types, if you think of when you go for a job interview, if you've had a few in your time, like I have, you don't just forget about the previous time you went for a job interview. You're shaped by what happened during that process, and it can influence how you approach the one that you're currently going for. So we would reflect before action. We wouldn't necessarily sit down and say, right, I'm going to reflect before action, but we consider it before we go. We think what question we might try and make an educated guess about what type of questions we might be asked and what kind of responses we might give. When we're in the interview, we will engage in reflecting action, because we'll draw on experiences to answer and respond to the questions that they're asking. And reflecting on it afterwards, we might think, how did that go? You might not think about it straight away. You might think that feels a bit raw to reflect on it straight away, but I'll reflect on it a bit later. And if you find out you've got the job, obviously that's fantastic. But if you don't, then you might think, right, what could I have done differently next time? You might ask for some feedback. And then the next time you go for a job, you'll again revisit that experience of that job interview, and then say, right, what am I going to do differently this time in order to have a better outcome or give it my best shot? So there's different ways of using that, and looking at different time points can actually help you expand or challenge or reaffirm your own perspective. So that's why I've put that back in there. But I'll just do this as a sort of summary, if you like. So we've got the before action. And one way you can do that for reflection for your OTAs is planning for the experience, basically. So you notice what's expected of you, you discuss it with your training officer, and you look at the considerations part of the curriculum as an aid. You do all that. You might at this point identify how you feel about embarking on that training activity as well, what you hope to learn from that activity or experience, and what you hope to gain insight into specifically. You might ask yourself, do I anticipate any barriers to being successful in doing this activity? What opportunities are there to ensure that you're successful in fulfilling it? Do you need clarification from anyone before you embark on it? And what actions are you going to take in preparation for it? So do you need to have a definite plan before you go in? And that might be, let's say you're going to attend an MDT meeting and observe that. Do you need to look at the agenda for that MDT meeting? So do you need to look at the patient notes before you go in? All those kind of aspects to plan for it. So it's being aware that you're not just passively going along to sit and observe whatever might crop up. It's actually getting you to think about it before you engage in that activity, which is really important skill as you're going into the working into the as a healthcare scientist. In action, it's the decision making during the event. So it might be that you change your focus of what you observe because there's something unexpected that crops up that piques your interest. Or you might observe someone engaging in reflection and action themselves. So the colleague alters their approach to a patient who becomes upset, for example. You might have your own preconceptions challenged whilst you're in there, and it might actually bring up some feelings for you at that point of, actually, this is, professional curiosity, or around, you might think, oh, actually, this is made me get a bit concerned about what I'm expected to do in my own practice in the future, and I might actually want some reassurance around that. So it's not just about recording the facts that you observe at that point, or acknowledge the facts of the things that you observe at that point, but also your feelings about it at that point in real time. You might make a note of something that you're unsure of to ask for clarification later, and that might be literally making a note of it or a mental note of it, or not long after you make a note of it. And if you get the opportunity, you might ask questions at that point of what you've observed. So in between patients, if it's a clinical scenario, but obviously that depends on how appropriate that is at that point. Then on action is after the event. So we know that already. It's taking a step back, analysing what you the experience, emphasising the learning linked back to the training activity. You might engage in a professional discussion with your training officer or other peers at that point, so that you can make more sense of the situation. And that again helps your learning from it. You might revisit your reflecting action notes if you did engage in reflecting action, and reassess how you feel about the situation now you've taken a step back from it, and think, actually, although I felt a bit uncomfortable during it, I could actually recognize that was a really positive experience to be involved in, because it's enabled me to think differently about my role that I'm going into, so you can draw on that, and that can enhance your learning. And then, of course, it's about identifying action. So how it's going to influence your own practice. What actions are you going to take following that situation to enhance your learning from it? And one of those actions might be, actually, I want to go and observe another clinic delivered by somebody else, led by somebody else, or I might want to attend another MDT meeting because I'd like to see it, see another perspective of it, or see another stage in that process. So there's lots of different ways that you can actually set yourself sort of actions from that. It doesn't have to be too far in the future. It can actually be in the short term what you're going to do to take the learning forward. And then beyond action, this is about drawing on past and current experiences in order to evaluate and reevaluate them. So some examples for this might be that you engage with other trainees to share stories of those experiences, and that can transform your view. You might revisit your reflections on the experience when preparing for the observed assessments for the module. So you know that you have the DOPS, OCEs and CBDs at the end of a module. And those training activities have prepared you for those DOPS, OCEs and CPDs. So when you come to prepare for those observed work-based assessments, where you're being observed to undertake certain activities, then you'd revisit your reflections from these OTAs to help prepare for those. So that's beyond, revisiting and reevaluating those experiences to support you in actually developing those skills or implementing that learning. But of course, like we said, that can also be further in the future as well, because we don't just have isolated incidences and then move on to the next. We take what we've learned from those experiences into our next stage of learning. So that just illustrates the connection between those training modules. This is from the work-based assessment standards again. Those training activities that you engage, develop evidence for, reflect on, prepare you for your observed assessments, so those DOPS, OCEs and CPDs. So if you think of a training activity like you observe a clinic for a day and reflect on the processes, the OCE might be explain a procedure to a patient. Well, you've observed somebody else engage in a clinic for it, and you might have done that multiple times. You might think, actually, I want to see more than one clinic. I want to get a flavour for how that is conducted, how they explain procedures to patients. Then the learning you gain from that will help you undertake that OCE as well. So that's where you can engage with that reflect beyond action. So you've had the action, you've had the experience, if you like, of observing somebody else. how's that going to influence your practice now when you come to do this observed communication event, this OCE? Okay. And this just serves as an illustration, if you like, to show how they might be connected. So if you engage with reflect before action and reflect in action, they're both going to influence your reflect on action and reflect beyond. You know, you're going to draw on those in order to reflect on the experience, and you're going to draw on all these when you reflect beyond as well. Okay, so that's just an illustration of that. What I have got, and I will be putting this on the Learning Hub, but I've got some guidance I've produced for you, and I've shared this with your training officers as well, in order to support you with actually using this 4-dimensional approach. Like I said, you don't have to use all 4, but it provides you with some questions that you can ask yourself. So if you're going to engage with reflect before action, this gives you some reflective questions, and actually your responses to these questions will actually be your reflection. So it will give you an opportunity to sort of help you with that. And hopefully it's a useful exercise. Same with reflecting action. If you asking yourself these questions, and where it says make a note of anything, that can be a mental note that you've got to, you know, if it's not appropriate for you to be writing stuff down, then don't. And again, we've got reflect on action. What did you notice? How has this contributed to your understanding of practice? What will you take from the experience moving forward? It's all about prompting you with questions in order for you to engage with that type of reflection. And again, we've got beyond there as well. So hopefully that's a useful resource for you. And I've shared it with training officers as well, because they can use it as a resource to actually prompt you with your reflections too. I'm conscious I can't see anyone at the moment. I just want to check nobody's put anything in the chat. No, that's fine. So let's go forward. So as a little summary of that, basically, you're required to reflect at 2 points in time. Okay. You know, you can do more than 2 points in time. There's nothing wrong with that at all. But you know, you can reflect before action and after action. You can reflect soon after the event, and then a week later, they're still sort of reflect on action, but they're still at 2 different time points. You can reflect soon after the event and then revisit the event later following your assessments, in terms of when you've been assessed via the OCEs, the DOPs, or the CBDs. So then you can collate it together. Another way of doing it, you might reflect at the end of a module, and revisit those experiences and say, do you know what, this is what, you know, as a collection, this is what I've learned from this module, and this is what I'm going to do taking it forward. So there's some flexibility there, but obviously speak to your training officer about it as well. Just to remember, reflection in action is dynamic. So when you reflect on action, you may consider how you engaged in reflecting action as well, or you might include some of your notes about how you felt during the experience as well. It's not identified there on the guidance that I've added to, but it does. They're just examples. You can still include your reflecting action, but it might be as notes, that you know, your initial feelings about it, and then you revisit that as a part of reflection. Reflect on action, which is after the event. Yeah. So there's a lot of combinations that you can use with that. So, you know, there's no one's going to prescribe to you, you must reflect before. You don't have to, but it's good practice to plan for what you're going to go into. And if you're going to plan for it anyway, then that's a perfect opportunity for you to just stick that in as one of your first reflections. Structure then. I recognise, that there's lots of different models out there, as I've mentioned. I haven't gone through them. You can find out more about those. A simple Google search will bring up a huge number of different ways to structure different models of reflection. If you look on the Learning Hub at the modules that are produced as an introduction to reflective practice, we mentioned some of the common ones. So you've got Gibbs that somebody mentioned. You've also got Kolb, which I'm used to, but that's because I trained as a teacher straight lecturer. So Kolb was used a lot in education. Gibbs is very common in health. And then we've got this structure, which is the what, so, what, now, what, which is associated with Driscoll, Rolfe and Borton. And I've identified this one because I think actually, personally, I think this lends itself well to the OTAs, but that doesn't mean you have to use it at all. All of them have commonalities for obvious reasons. So the common features of all models is that you have an experience, you review it, and you identify what the learning is and the action is from that experience. So they all have that kind of element to it. So I've just shared this one because it shows that really, really simply. And so basically the components of any reflection should go through this in some way. It might be broken down a little bit more. So Gibbs breaks it down even further, but in essence, this is what you're looking at. You're looking at a description. Now that description is going to be the shortest part. You're just setting the scene. It's just going to be the summary of key points of the experience. And it's only going to include the most significant information. It's not an essay. You need to be selective. It's not a blow-by-blow account of everything that you saw step by step. It's not where the learning occurs. So that's why you don't want to be writing a big essay about what you saw. It's not a police witness statement. It's just the pertinent points of the experience. So I shadowed a consultant and I saw that they did X, I specifically shadowed them whilst they were doing X, Y, and Z. It might be some bullet points there about overall what you saw. This is the foundation of where the learning is. This is what is the experience that you're going to get the learning from. But this part of your reflection is not identifying the learning. It's just identifying what the experience was. The important bit is the review and the impact that has on your own practice. So under the review, you might say what was good or bad about it. You might identify if there was any surprises there. You might link it back to when you did your reflect before action. You might say, actually, this conflicted with that. You might identify any significant moments there that piqued your interest. If you engage with reflect before action or reflect in action, you would draw on that and whether it was challenged at that point. And it's basically here where you are going to say whether your perspective of the practice that you observed or the actions that you observed have been expanded, challenged or reaffirmed, basically. So that's taking that straight from the assessment standards there. And this is where the deeper learning occurs because you're unpicking the experience. And then the impact in action. This is where you're going to identify how it will impact on your own practice or your own behaviours and attitudes. How are you going to assimilate what you've learned from that practice into your own, assimilated what you've observed or experienced into your own practice? What are your next steps? And like we said, that could be simply as I would like to observe another clinic, I'm going to arrange that, or I've got some questions I need answering, so I'm going to follow up those questions. You might identify how you might do something differently to what you observed. And you might identify there how what you observed or experienced will help prepare you for your in-person assessments of your own practice for that module. So the DOPS, the OCEs and the CBDs. And this basically reinforces your learning at this point and makes it mean. So I've just put some in there. So the describe bit, this doesn't mean you physically have to sit down and describe it, but you acknowledge the fact what the training activity is. You've looked at it, you've identified what the outcomes are, you've discussed it with your training officer first, and you're clear about what's expected of you, basically. You identify how you feel about embarking on the training activity, what you anticipate you'll learn from the experience, and what you hope to gain from it. So you've all come up with this already. What actions you're going to take in preparation for the experience? What is your plan for implementation? Do you need to meet with anyone prior to the event or experience? So it's just about thinking about it and preparing yourself for the experience so you can get the most out of it as well. Because that's what's really important. That might be your only opportunity. It might not, but it might be, depending on the department that you're in. So you want to make the most out of it that you can. Beforehand, and part of your reflection after might be, I wish I know I can't get it might not be feasible for me to undertake another observation in this way, but I would like to learn more about X, Y, and Z, and that's fine. But as long as you've made the most of the experience that's in front of you. I've still got some things I want to share with you, particularly around format, because that's come up a couple of times. And that's why I changed the description of the session from reflective writing to reflective thinking. Because whether it's written or not is by the by. However, recording reflections does have a benefit, and how you record that is up to you. So you could record it verbally or written. You could do a video diary. All those aspects of it can be uploaded to one file. One file will accept audio and video files as well. So if you prefer, for whatever reason, you struggle with writing it down, but you'd prefer to talk out loud, if you like, about your reflections, then you can do it. But that's, you've got a record there, but also verbal discussions that aren't recorded with your training officer or assessor are also perfectly fine. Because what your assessor can do, if they're happy to do this, and you've got to discuss this with your training officer and assessor, but this is the message that we've also relayed through the one that we held on Tuesday. It's perfectly acceptable from our perspective for you to have a verbal discussion and also, reflect verbally with your training officer. They might ask you questions to actually extend that reflective thinking, and they can put a statement in one file to say, that you had that discussion, and you identified what you're going to do to take forward, and they're happy to sign it off. Or it might be that you discuss it, you do a combination of the two. So you have a verbal discussion about it, so you discuss the experience together, and then you do a reflective account following that discussion on the whole experience, including that discussion. So, I observed so do this. I discussed it with my training officer, and as a conclusion from this is what I've learned, and this is what I'm going to do to take this forward. So you can do it as combinations that that suit you and your assessor or your training officer as well. Like I said, you can record, if you prefer to, you can record your reflections verbally or visually, and it allows you to revisit those reflections later on, though, if you prefer to do it that way. So, in summary then, and this is something that I've shared with the training officers and assessors on Tuesday, there's a little map of reflection or reflective practice there, specifically related to the observational training activities. And again, I can send this out as a document, but it will also go on the Learning Hub as a document as well. If it's useful for you, it's just a way to help you sort of frame how you approach reflections for the OTAs, because you're not physically doing the experience, in the sense that when you're shadowing a consultant, you're not doing what they do, you're observing what they do. So it takes a slightly different slant to when you come to do any reflections for your own practice. But this allows you to sort of explore that process, if you like, of particularly reflecting, sort of combining some of these already. So at the top there, I'll just enlarge this with my zoom. So what you've got is, identifying what the observational training activity is, and at that point you might engage in reflect before action. And then this is as you've had the event, what you do beyond action, on action. So when you're reflecting on action, so after the event, so summary of key aspects of what you experienced. You might draw on there any reflection in action you experienced. Any additional evidence that you might want to include, don't have to. The reflection is potentially enough. But if it's not, you might have some supported documents in there. So if you attended an MDT, you might have some redacted documents that we discussed, obviously respecting confidentiality. So don't ever upload any documents that have got sensitive information in there, so of patients or colleagues. It might be additional evidence of post observation discussions you've had, so discussions you've had with the person that you observed or your assessor or whatever. It could be answers to your questions, so if you ask some questions post experience, that might be additional information there. And then you reflect on all that. So this is why it's all wiggly. This is sort of adapted from a map of reflection designed by Moon, but I've applied it to the OTAs. And this is where, it's not linear. You might revisit and rethink about the experience, and then you review it and think about it as of its significance of it on your own professional practice. And then there might be other processes you consider, and all that will result in a product of some kind. And that product will either be there's a conclusion, you've identified a set of recommendations for yourself, and so that is your conclusion, that you've got an action plan there that you might revisit. Or you might identify that there was an area which you want further exploration of, and that might be that you think, actually I want to attend a second clinic to observe somebody else undertaking a clinic, just to compare different techniques, different approaches, different types of patients. And then you engage in more reflection, and that brings us up here, and that provides a wider perspective, and that's where you reflect beyond action might come in, where you start to look beyond that. Okay. Just to mention, there are other resources available. This is for trainees and trainers. The Need for Speed one, that is on our Sharing Good Practice website as well, catalogue. We've got a number of webinars on reflective practice there as well from HSST trainees who have really embraced. They've done a series of webinars and talks. We did one yesterday as well, and their perspective on reflective practice, very inspirational. If you are somebody who really struggles with reflection and accepting it as a way of learning, then please watch some of those very inspirational HSST trainees. Our consultants of the future for healthcare, in healthcare science. So they talk about it in very inspirational terms. Got the reflective practice modules on the NHS Learning Hub. If you haven't signed up to the NHS Learning Hub, go to the trainee section of our website for the STP, and if you go onto the training standards as part of it, it tells you how to sign up to the Learning Hub. Dead easy. And again, I can send details of that out when I email you, or with the recording, etc. And of course, if you want to, you can watch the one that we delivered to trainers and assessors. So the assessors that are on here today, please watch that one if you didn't attend it. And if you are a trainee, you can, of course, watch that. It will come on our website very soon. And thank you for bearing with me. I'd like to hear from you on how you've applied what we've done today for your OTAs. And that's it from me.